Hello, everyone. So, today is my first day back to normal life, to patient care after recovering from COVID. What happened was a few weeks ago, I woke up in the morning with a fever. It was 100.4, and I was feeling very hot, very flushed. And I checked my temperature, and it was 100.4. And I'm not usually someone who gets a fever. And I had been, working in the hospital, and there were patients who were coming in who were later diagnosed with corona and COVID. I knew that I was getting exposed, and I was taking all the precautions that I could, wearing the shield, the mask, the PPE kit, and everything else. But I knew that I was having exposure, and the second I got a fever, I said, okay, this is COVID until proven otherwise. When I look back, that morning of the fever, so it was a Monday morning when I got a fever, a Monday night going into Tuesday morning, Tuesday early morning when I got a fever, and Monday morning when I woke up, I was feeling fine the entire day, but I had a tickle in my throat, a little bit of weakness. I had some back pain, some leg pain, and I just thinking this is normal, right? I mean, you can have back pain and leg pain and diffuse body pains here and there. I didn't think too much about it, but then those were the signs leading up to my illness. Thankfully, I had the mild version of COVID. I did not get. I had fever for a few days, and then I had some body pains here and there. And I got myself tested after 2-3 days, and it came back positive for COVID. And then I got a second test and all that stuff done, and they were all subsequently fine. So when I was sick so when I was quarantined for the entire duration of almost 18-19 days, actually what ended up happening was after 4 in the morning when I woke up my wife, who was right next to me, and I told her, listen, I've got a fever. And so we immediately we did isolation. So she went into a different room, I went to a different room. I stayed in the room, and then we did all that. And 6 hours later, she told me, I think I have a fever, and she checked her fever, and she also was sick. So we actually ended up having the entire quarantine time of the entire duration together. So it was kind of good that there was company, but I felt initially when she said I've got a fever, I said, oh no, did I give it to her? So that was definitely something concerning. But thankfully, she also had a very mild version of COVID, and she's also recovered, and now we both are back into patient care, taking care of of people who are sick. And and I'm looking forward now to being a plasma donor. I think that's important. I think that's something that's the onus is on us as human beings, as citizens, as healthcare providers, and anybody else for that matter. That we should all, if you've recovered, let's do something good for society. Let's go donate plasma and maybe save somebody else's life. One more thing was that when we were sick for the entire 2 weeks duration, we did complete quarantine. So we actually divided the house into two parts. One where me and my wife were staying, it was a couple of rooms, and then the other part of the house that has a separate entrance from the main gate, from the main door of the house, and leading into the kitchen. That is where our help was there. So he was wearing the entire PPE kit the entire time. We gave him everything that was required. We were following all social distancing practices. He would come in and out of the house for maybe an hour the entire day. Leave the food, make the food, and all that stuff. And after we recovered, we actually got him tested. So we sent him out. After a few days, and we went and got him tested, and his test came back negative. So that was good, and we were all very comfortable with that and reassured with that. That his test came back negative, and we were all using, we were using the PPE kits for him, the mask, the shield, something similar to what anybody would do in the hospital, right? What I as a healthcare provider would do in the hospital when I'm taking care of COVID, really, really sick COVID patients who have a very high viral load. We were giving him the exact same precautions, and I think it's important that anyone who's caring for the person who's got COVID, the attendant of the person who's caring for COVID, use all these precautions, the PPE kit, the mask, the gloves, social distancing practices, and you will be fine for the most part. So you will be fine, and but just use your common sense and don't have let lapses happen. So I'm glad that I was able to recover from COVID. I'm glad everything went well, and it'll be great if you can all also come and share your stories. What exactly happened? How did you get sick? What was the journey like? And share it with us, and let's give hope to everyone of what it was all about. One thing which did happen with me, I must say, was when I got that I think 4 or 5 days into the illness, around the 6th day mark, I lost my sense of smell and taste. So all the food that I was eating was exactly the same. And to check further, what I did was I took a deodorant and I sprayed the deodorant in the room, and I couldn't smell it. I had to go really close, and I'm like, yeah, I get a whiff. And my wife is like, Sonia is like, there is so much deodorant. What are you doing? So that was kind of funny. So I still don't have a sense of smell or taste, but that's a very small thing in the entire in the big picture. We're glad we've recovered. We're glad we're doing well, and we hope you to recover. Whoever it is who's ill, your family member, don't lose hope. You will be fine. Yeah, so stay safe.